So my presentation is visible to you. So, hello everyone. This is Dr. Sajid, Head of Department of Chemistry, Pakistan Institute of Nuclear Engineering and Applied Sciences. So this presentation is about the nuclear medicine and radiation therapy in Pakistan, current status and future perspective. So this purpose of this presentation is just to share for the first time the nuclear medicine in Pakistan with Turkey in this platform, so that in the future we can develop more collaborations and we can share the ideas and knowledge. So this is Pakistan. We have near Afghanistan, Iran, India, China, and Arabian Sea, and we are really huge country with five provinces. And if we talk about nuclear medicine, before talking about nuclear medicine, we have to talk about some statistics. This statistic is from year 2025. So we are the population of 229 million people, and we are dealing with a different kind of issue. The one of the issue is, of course, the cancer. And if we see the statistics, so almost uh, zero point 0.1 million cases, the new cases every year we are seeing of the cancer, and zero point 0.1 million deaths due to the cancer. And it is people are thinking like if the ratio will be the same, that in next 5 years the ratio will go up to 0.3 million. So if we see the imported cancer cases in Pakistan, so in case of male, the lip and oral cancer is the leading cause, and then the other like prostate cancer and other disease come in the second and third number. In case of women, breast cancer is the leading cause, leading cancer, and this is all about the statistics, and that's the reason that Pakistan is seriously thinking about the cancer treatment for our patient. So when we started the nuclear medicine in Pakistan, the first nuclear medicine and oncology center was established in Karachi, one of the biggest city in Pakistan, in 1960. So it was 1960 when we start this business of nuclear medicine and oncology. Later on, we have another center in 1963 in Lahore, another big city of the Pakistan. So you can say that these two big cities are in a two different provinces. So collectively, we have five provinces. So with the start, we established two nuclear medicine oncology centers in two different states of the provinces of the Pakistan, in the some big cities, and then later on, PIC developed its first nuclear medical center in Jamshoro Singh in 1965. Currently, we have a nuclear medicine and oncology center all over the Pakistan. We have more than 51 nuclear medicine setups, out of which 20 managed by Pakistan Atomic Energy Commission and 31 managed by some private sectors. So Pakistan Atomic Energy Commission is mainly dealing with these nuclear medicine institute in Pakistan. So starting from the one side of Pakistan to the other side, we are covering the whole Pakistan, so that we are providing the nuclear medicine and oncology facilities to all the patients all over the Pakistan without much traveling. If we talk about the nuclear medicine equipment in Pakistan, so we have gamma cameras, more than 90 gamma cameras in a different hospital, because some hospital has really huge setup, so they have a more than one gamma cameras. PET-CT scanner, we have a 9, SPECT-CT scanner zero 05, and cyclotron zero 06. So if you see this slide, you can see that we have a more than 90 gamma cameras. What is the reason? The reason is that the reactor technology in Pakistan is really good, and we have a huge production of technetium 99M and iodine 131, which we produce from the reactor, research reactor. This is the reason that most of the time in our hospitals, whenever they are going to start new setup, they start with gamma camera because technetium 99 is our local product. But now, because the technology is moving towards more cyclotron-based radioisotope like gallium-68, iodine 123, and of course zirconium 89, and so on, copper 64. So that's why now Pakistan nuclear medicine centers are gradually adopting the new technology like PET-CT. And for this, we have the 09 PET-CT in Pakistan, in big cities of the different provinces. And with these, we also have a cyclotron. And if we don't have a cyclotron, it means we are using a gallium generator to operate this PET-CT scanner. Similarly, to cope up with the advancement, we also going to install some new SPECT-CT scanner, and now the number is 05. So this is important slide just to tell us about PET city facilities in Pakistan. So PET city facilities in Pakistan, the most important hospital is the Shaukat Khan Memorial Hospital in Lahore, which is the biggest city with big population, and then nuclear medicine and oncology, Lahore, uh, and then Karachi. These are the different province cities in Pakistan. Like in Turkey, we have Istanbul, Izmir, and so on. So these are the main cities. So in these cities, we have city cameras from Discovery, Philips, Simpson. So mostly we import these cameras along with baby cyclotron for the production of different radioisotope. So currently we are working with F18. F18 is the main radioisotope that we are using in these PET CT cameras. And then we have another production system that I told you before. We have a research reactors, and we have two research reactor at Pakistan Institute of Nuclear Science and Technology. Shortly, we can say PINSTIC. So in PINSTIC, we have two research reactors, PAR1 and PAR2, and the production of radioisotope in we have started this production in part 1, reactor 1, in since 1965. So this facility that R1 is mainly a facility where we are producing technetium 99, lutetium 177 currently, and iodine 131. And because this Power One is really very old reactor, so now in these days we are going to construct another reactor with the name Power 3, and soon all the production facilities and everything will be shifted to this new reactor, which is called Power 3. Uh, In the Paradigm, we are producing different kind of radioisotope. The most important is highly pure, high quality iodine 131, and we normally produce this radioisotope by using wet distillation process. We also using a dry distillation technique, but mostly we use the wet distillation. Similarly, we have a phosphorus 32. We are doing this its production by using dry distillation. We are also producing sulfur 35. So sulfur 35 and phosphorus 32 are not, we are not directly using them in nuclear medicine, but we are using them in the research. But the main product is iodine 131, which we are using for the treatment of thyroid, and sometime we labeled MIBG for the treatment of the cancer. Next, we have a molybdenum 99 loading facility for the preparation of technetium 99 and generator. So currently our capacity is 100 curie per batch. We are not importing technetium 99M. Currently, we are meeting the domestic demand from different hospitals of Pakistan. We also producing lutetium 177, and for this we are using lutetium 176. Molybdenum 99 production facility. We have a hot cell with master slave manipulators. We have a few molds, glove boxes. Everything is GMP grade, and we are using these facilities to treat our molybdenum 99, and then we are using it to produce the technetium 99 generators. So these are the setup inside the instate where we are using different plant for the production of iodine 131. And so we have a two type of facility. We are using wet distillation as well as we are using the dry distillation. Wet distillation setup is old one, and dry distillation is a new setup. So currently we are using only dry distribution setup, and our capacity is per batch is 10 curie per batch in year 2025. Similarly, from since 2003, we are on regular production of technetium 99 and by using molybdenum 99. And this complete technology we have and we have developed by ourselves, in which we are irradiating molybdenum, processing, and then making the technetium generator for different hospital of Pakistan with the name of PakGen. So this is just a short description of our process. We have target plates of molybdenum. We will load this target into the rabbit and put inside the reactor core, and then we move this target after irradiation in the sheeting block or to the processing facility. Then we use completely remote system to process this molybdenum, and then we purify it, and finally we use it to produce the technetium 99 generator by using the system that we already know that we use for the production of technetium generators. So for example, if we see in the step one, target irradiation, number two, step target transportation, then we move it to the hot cell for solution and filtration. And after filtration, we will remove the iodine and then we process it through a different processes, and then we remove the solid waste and then xenon, and later on we will make it in the form of cake. And in the fourth step, the hot cell to process the separation of molybdenum 99 and purification, and finally the waste go in the medium waste container, and the reactivity will be collected. And later on, in the hot cell number five, in the step three, hot cell number three, we process the dispensing of this molybdenum 99 and the transportation to the generator production facility. This molybdenum will finally go to the generator, and where our team will make process it and make the technetium 99 generators. So this is uh, system which is showing the production to of the molybdenum 99, and then its conversion, processing, and finally the production of technetium 99 generator. And later on, after passing the quality control test, then it will move to the nuclear medicine center where it will use for the gamma camera or SPECT CT imaging. Apart from technetium 99 and iodine 131, we are also producing zinc 65, selenium, arsenic, uh, bromide, rhenium 188, samarium 153, and all these radioisotopes are being used in different activities. But if we specifically talk about the nuclear medicine, rhenium 188, iodine 131, samarium 153, and lutetium 177 are used for diagnosis or therapeutic purposes. Uh, Law and regulation on GMP. GMP is followed in all the medical centers as per direction of European Pharmacopoeia, Ministry of Health. Pakistan Nuclear Regulatory Authority is also responsible to oversee its implementation and quality control. That's the reason in the district where we are producing these radioisotope and in the hospital where we are using these radioisotopes, they are equipped with different kind of quality control tests. For example, to check the radiochemical purity by HPLC, radio TLC, gas chromatography. To check the radionuclide purity, of course, we use a gamma spectroscopy system in the hospital as well as in the district. We have this system available. To check the chemical purity, we use a UV visible spectroscopy, and for biological purity, we do different kind of sterility tests. We check the pH, endotoxin test, and there are many more tests just to ensure the purity and the quality of the product. Uh, I mean isotope as well as radio labeled compound. For the radiation therapy, we are using linear accelerator. We have a more than 32 linear accelerator, cobalt 60 unit, more than 31 tachygraph unit. Uh, we have this type of facility, but heavy ion we are currently not using in our hospital to treat the cancer patients. Then I will talk about my institute. For example, I talk about the different hospitals in Pakistan. I talk about the PISTIC, which is the radioisotope production facility, which is producing technetium-99, iodine-131, and lutetium-177. There is another Department of Chemistry and Nuclear Engineering in Pakistan Institute of Engineering and Applied Sciences, where we mainly focus on the research. Means our domain is to do the research, to produce new types of kits in our departments. So in Pakistan Institute of Engineering and Applied Sciences, what we are doing, first of all, we working with the production of radiopharmaceutical kits. We know that currently we are importing the kits like Tota kit, PSMA, FAPI, and we are using it for the diagnostic and therapeutic purposes. But we also very interested for the indigenous and local development of these kits. So this is the reason that our staff, our students are taking the projects and they are interested in develop these kind of kits. We are not only producing or try to synthesize these kits, but we also want to do some structural modification to improve the pharmacokinetics of these kits. Second, we are also interested in radio labeling of monoclonal antibodies because we know that targeting efficiency of monoclonal antibodies is much better than peptides. This is the reason that we are also working in this area. And similarly, we are working on the synthesis and design of new chelators, linker, and bioactive ligands for the radio labeling. For the BNCT, we know that the boron neutron capture therapy with the help of BPA is really promising technology to treat the brain tumor. But we are also interested to translate different kind of peptides, and we want to install the boron uh, precursor to that peptides just to treat a different kind of cancer by using a neutron beam. So this is another area where we are working, and currently Department of Chemistry PIAS is collaborating with Korea Institute of Radiological and Medical Sciences in this area. They got some kind of funding for this project, and we are working together to find out the different ways how this boron neutron capture therapy can be used for brain as well as for the treatment of other cancers. Similarly, in PIAS, we also supervising the masters and PhD student in the field of nuclear medicine, radiochemistry, molecular imaging. These are the areas where IAS is interested in collaboration. We believe that in Turkey, the cyclotron technology and cyclotron-based radioisotope production and use is really strong. And in Pakistan, the reactor-based production of radioisotope is really good. So we want some kind of project, some areas where we can collaborate, we can share the knowledge, we can share the students, and we can do a lot by writing the projects of mutual interest. The core facility at PIAT that we have, of course, we have hot labs, and the purpose is to teach the student how to synthesize different kind of radiopharmaceutical, GMP as well as under non-GMP compliance. Then, for a research purpose, we have our own facility to check the quality control of radiopharmaceutical by using radio TLC and radio HPLC. We have a both type of instrument available. We have a dose calibrator to measure the activity, and we have a lead shielded fume hoods and areas to work with the radiopharmaceutical technology. Recently, PIAS also purchased a gamma camera. The purpose of this gamma camera is to perform in vitro and in vivo imaging study by using the radiopharmaceutical produced in our labs. We also have an automatic gamma counter in which we can read, we can study the biodistribution and uptake analysis of newly designed drugs in mice. For analytical characterization in PIAS, we have a ICP-MS for the trace metal analysis of mainly synthesized radiopharmaceutical. We have a FTIR. We also have a GCMS, UV visible, and NIR spectrometer. So we can say that if we are working in this area, from starting from the organic synthesis to radio labeling, we have all type of equipment and facility for the to study the quality control and to check the purity of our product. So, the areas in which we are actively seeking national and international collaboration are the area of radiopharmaceutical science, nuclear medicine, and molecular imaging. Our lab at PIAS offers advanced capabilities in radiopharmaceutical kit development, antibody and peptide radio labeling, precursors for the synthesis of BNCT, organic and analytical chemistry, in vitro, in vivo evaluation using SPECT, imaging, and gamma counter, joint research projects and grants, co-supervision of graduate student, exchange of technical expertise and training, development of novel radiopharmaceutical and imaging methods, and training of nuclear medicine and oncology center of Pakistan. This is all from my side. Thank you very much, ladies and gentlemen, for your attention.
Salam alaikum.
Welcome, sir. Thank you so
Yes,
much.
it's been a
This was
pleasure.
an this was an introductory lecture, not a very technical, and just the mission is to just to explain nuclear medicine in Pakistan so that in future we can have a better collaboration, inshallah.
Yes, yes. I mean, that was very important and informative for us to understand the capabilities. And in many cases, I
Yes.
see, it's far beyond what we have over here. So I'm sure there'll be opportunities for lots of collaboration. Thank
Sure,
you.
sir. Sure, sir. Anytime
Thank you.
welcome. Thank you so much. Thank you.
Thank you.